You know, the problem with prescriptions is that well-educated, licensed authorities like doctors say you needed it. Then when your addiction tells you that you need it, it gets very confusing. And the time that it takes to figure things out, a lot of damage can occur. After taking a routine dose of prescribed medication for pain, some people develop a chemical dependency without even knowing that it's happening. Unfortunately, as soon as they realize that they cannot stop taking the drug, they may be too ashamed to tell their physician, or they're afraid that the medication will be discontinued, so they don't seek help when they need to. At the risk of sounding cliche, the first step toward recovery from painkiller dependency is identifying and admitting the problem. After a dependency is realized, treatment can and should be sought. In a minute, we'll examine a list of warning signs that will help you identify addiction when you are only taking a prescription. Many of the warning signs might also be explained by other disorders like depression. But since painkillers are a central nervous system depressant, that can be confusing too. While other warning signs are more clearly linked directly to addiction. The warning signs that raise the red flags include, number one, your usage increases. You know, over time, individuals take many prescription medications and become more tolerant to the effects of their prescribed dose. Increased dosage often indicates that the original amount is no longer providing relief. Tolerance, then, is a measure of addiction. If you're getting more tolerant, building up more tolerance to your drug, then you might start considering the fact that you might be addicted. Number two is a change in personality. Changes in a person's normal behavior and reactions to things can be a sign of dependency. Shifts in energy, mood, and in concentration may occur as everyday responsibilities become secondary to the need for the relief the prescribed medication provides. Nevertheless, such changes can be explained by other things. Number three is social withdrawal. A person may withdraw from family, from friends, and from other social interactions, but that can also be a sign of depression or even social anxiety. Number four, ongoing use. Patients that complain frequently about still feeling pain or request to extend a prescription long after the medical condition has improved, they should be monitored closely. Those who gripe about doctors refusing to write a prescription, they show signs of dependency. While this appears to be a sign of dependency, pain is subjective and it's personal. What confuses matters further is that painkiller drugs tend to cause pain receptors to become more sensitized, resulting in an elevated perception of pain. That in itself can be a type of dependency. Number five is going to great lengths to obtain prescriptions. A dependent person may spend large amounts of time and energy and money looking for supplies of the drug. Examples include doctor shopping and visiting multiple doctors to obtain the same or similar drugs. Preoccupation with securing a supply of medication demonstrates that the drug has become a top priority. This preoccupation and priority are clear signs of addiction. Number six, change in appearance. Personal hygiene may diminish as a result of a drug addiction. Significant weight loss may occur and glazed eyes may be evident. While depression or other illnesses could explain this phenomena, it tends to occur with addiction. Number seven is desensitized emotions. Apathy, an attitude of indifference, a lack of emotion, and demonstrated disinterest in things that previously interested them. This is another sign that possibly can be explained by other problems. Number eight, increased activity. Regular activities and favorite pastimes no longer provide the same enjoyment that they used to. Number nine is rather indicative of addiction. Blackouts and forgetfulness. Unless one is susceptible to diabetic blackouts or has a brain tumor or other brain disorder, a sure indication of dependence is when the person regularly forgets events that have taken place and appears to be suffering frequent blackouts. That is, lapses of time where the person may or may not be functioning for which they have no recollection. Number 10 is defensiveness. Abusers who attempt to hide a drug dependency may lash out and become very defensive if they feel their secret is being discovered or their addiction threatened. This is an impediment to those who seek to help them. Trained professionals can assist with such interventions to increase the likelihood of reducing defensiveness and the success of accessing treatment. To find out more about prescription painkiller addiction and its treatment, see our MySpace site at myspace.com/NHS Oklahoma. To get help, call in Tulsa 918-835-3017. Again, that's 918-835-3017. Or in Oklahoma City, 405-672-3033. Again, that's 405-672-3033. Or Miami, Oklahoma, 918-542-1786. Again, 918-542-1786. Now I want you to think for just a minute. What would life be like free? Call now.